Bismillahirrahmanirrahim. In the management of chronic hypertension from the RCOG guideline about hypertension in pregnancy, we studied some initial points that what advice we need to give to the patient. Secondly, which type of medication she needs to take. So in this video, we will basically study the antenatal appointments. About this, it's written that antenatal appointments in a woman with chronic hypertension should be based upon different things like individual needs of the woman and her baby. Okay, depending upon that, we have to decide whether she needs weekly appointment or appointment after every 2 weeks. Okay, you can see that if the blood pressure is poorly controlled, then we have to do the weekly appointments, and if the blood pressure is well controlled, then it's okay. 2 to 4 week appointment would be fine. Now come to the timing of the birth in women with the chronic hypertension. About this, it's written that if the woman is before 37 weeks, okay, and her blood pressure is well controlled, like it is below 160 by 100 millimeter of mercury, and there is no other clinical indications, then do not offer birth before 37 weeks. But after 37 weeks, okay, after 37 weeks, if the blood pressure is well controlled and it is below 100 by 160 by 100, then we can offer birth even when the blood pressure is normal. That depends upon the individual circumstances of the woman, and we need to do discussion with obstetrician and also the woman. Okay, and if planned birth is needed, okay, if planned birth is needed before 37 weeks, then we have to give steroids to the woman, okay, or magnesium sulfate to the woman. That depends upon the individual woman's circumstances. We need to give these two things depending upon the individual circumstances. Now, how to do the postnatal investigation, monitoring and treatment. Postnatal. So how frequently we need to check her blood pressure? Okay, for the first 2 days, we have to check the blood pressure daily. Okay, chronic hypertension patient, so we have to check blood pressure daily for first 2 days, and after 3 to 5 days, means third and fourth days, from third days to fifth days, we have to check at least once. Okay, that we have to remember this daily for the first 2 days, and 3 to 5 days at least once between 3 to 5 days. Okay, and after that, as clinically indicated, okay, as clinically indicated, if she needs it more, then we have to do the frequent monitoring. Otherwise, we can discontinue frequent monitoring. Okay, and another important thing is about the target. Okay, the target BP, that should be lower than 140 by 90 blood pressure. That means we have to make our aim that we have to keep her blood pressure below 140 by 90. Okay, and then antihypertensive. As the antihypertensive treatment are concerned, we have to continue antihypertensive treatment if required. Okay, and we have to review. Okay, this woman needs to be reviewed after 2 weeks after birth. Okay, 2 weeks after birth, we have to review this woman. There should be an appointment with the GP, as is the case in the UK. Okay, or in our OPDs, we should review her blood pressure 2 weeks after birth.